Dr. Evelin Dacker is a Mexican-American sex-positive, integrative family medicine practitioner. And she, aside from being her physician self, she loves to teach people about sexuality, sexual healing, sexual acceptance, sex positivity. And through that, even destigmatizing certain sex things. And I would just am so excited about this because I really believe a lot of people don't know what sex positivity looks like. There's not enough conversations around consent and sex as pleasure and pleasure as being healing for us. And I love how you incorporate that into your medical practice, even, using, sexual health as whole person health. So welcome, Dr. Dacker. So nice to
Thank
have you.
you. Thank you. So
So,
nice to be here with you.
so for the general audience, would you please share, what is sex positivity?
Well, it is the understanding that sexuality is something that is good for us, that's something that belongs to us, and that moving away from the stories that it's a taboo subject, that it's something to not talk about, that it's something to hide. It's like one of those TMI conversations people often have. It makes us uncomfortable. So try to move away from that paradigm towards a place where sexuality is just something that we are as humans,
Mm.
normalizing it. And
Yeah.
that is my definition of sex positivity. It's not like, oh my God, you have to have a lot of sex, or that you're supposed to be sexual, or that you're supposed to be sexual with another person. It is not that. It really is just moving away from that stigma and fear and silencing that we bring to the conversations around sex and how we integrate that into our bodies and into our lives.
I love how you said sexuality isn't something you do for another person. Sexuality is something you do for yourself. Could you speak a little bit more about that, please?
Yeah. So I really see, we're told from even from sex ed and everything we know about sex from the movies, and it's something to do with another person. And we're supposed to be sexy for something else or to gain attraction. I really believe that's false. I really believe that sexuality is something that's deep within us as human beings. And we are given this gift of being able to connect to our bodies in a really deep and intimate way and to get pleasure out of it if we recognize that it's ours and
Mm.
that it's part of who we are, regardless if we're having any kind of intimate touch or intimacy with another person. When we reframe sexuality as being ours, it actually gives us freedom to be in our ultimate life force energy. I talk to a lot of women and men who, when they're feeling that kind of that, I don't know, libido or life force, I don't want to say, you're able to take that energy and bring it out, externalize it. And I really feel that sexual health is self-care.
Mm.
Sexual health is not about, oh, I have to be able to accept somebody into my body to make them happy. It's really about making yourself happy, finding a way to be in your body and away from your head. As a family practice physician, I deal with a lot of people who are often just in our heads. And then when we have a problem in our body, we just start taking it apart in pieces like, oh my gosh, I have heart disease. So now I have to do all these things for my heart. And we forget that we're all integrated as one thing.
Yeah.
So oftentimes sexuality is only seen when it's a problem. And I'm
Mm.
going to go back to heart health. We talk a lot about how do we prevent heart attacks? How do we keep our heart healthy? Well, it's the same way with sexuality. How do we keep our sexual health healthy? And it's always comes down to finding a place within yourself that you recognize how important it is for your body, for your mental health, for your physical health, and for what you want in this world and what people want in life.
You can almost tell the people that are integrated with their sexuality when they walk down the street. They radiate something, I believe. Um, so that's really interesting to hear you say that. And, you know, as far as the sexuality goes in terms of like heart health, I mean, it's a form of exercise. I remember reading about this woman. I remember reading about this woman who wanted to lose weight, right? And she and her husband were so disconnected sexually, and she just took it upon herself to just totally change both dynamics at the same time. So she started to lose weight by having sex all the time with her husband. And I was just like, I'd never heard of that before, you know, and there's so many societal and cultural constructs around sexuality, and it's a lot for people to have to break through. And you, as the founder and creator of the Stars Talk, I looked at your website, I checked it out, and the Stars Talk is just phenomenal and foundational, and I think would help so many people. So would you tell us a little bit about what is the Stars Talk and why should people use it?
Okay, well, let me go back a little bit and tell you the history and the origin of it and why it's important and then what it is. So,
Awesome.
as I was going through my perimenopause years, I started realizing how disconnected I was from my sexuality. What
Mm.
so many things I didn't know. And at the same time, I was getting extra training in something we call functional medicine, which is kind of looking at the foundation of disease, treating people from the bottom, not from the problems. And as I was going through all the modules and going to all the classes, I realized, wow, they never talk about sexuality and they never talk about pleasure. And as a
Mm.
woman in my perimenopause, treating women, perimenopausal and menopausal, I was like, how could we not bring this conversation to something really foundational for us?
Mhm.
And why isn't that a part of the basis of some disease? Because so many of us have trauma, there's just so much wrapped up in it, especially as a person in a female body who is getting older.
Yeah.
And so I took it upon myself at the time, and I've done so many courses like on holistic and integrative and herbal. Like I consider myself an integrative physician because I like having a lot of tools in my toolkit. And this was something I didn't have in my toolkit. So I started going and taking classes on sexuality and not classes on like the fundamentals of reproduction or how to, but really like what is it, like what's the juiciness behind sexuality. And when I started, I went to this one class and they talked about doing this elevator talk. And this elevator talk was like 19 different things that you're supposed to mention on the way up on an elevator to a hookup. And it was a bit
Wow.
much.
That's a
but
lot.
but
Yeah.
it's a lot. And I was like, wow, this is freaking fantastic. Like, why aren't we all taught something like this? Like, why is it only
Mhm.
taught for people going to hookups or non-monogamy? And then I went to some classes on kink and BDSM, just because I wanted to really expand my understanding of the sexual experience for people. And then I learned, wow, they do this pre-negotiation thing where they talk about what they want and they talk about what they don't want, and they create a container for them to explore in these many faceted ways.
Mhm.
So I took all that information. I thought, I need to teach my patients this. I need
Yeah.
to teach my children this. Like, the world has to understand, like, there's a way that we can actually talk to each other. And this was around, the Me Too movement and all the consent infractions. I'm like, wow, if we just communicated our needs and our desires and our boundaries, it could make a huge difference in how we treat one another and how we respect ourselves. And
Yes.
so I came up with the acronym STARS to really, and I distilled it into 5 elements that I believe are the 5 most important things that we need to know about ourselves. That's about integrating sexual awareness for us and then actually communicating it with a new partner, with a potential partner, even with a long-term partner. So the 5 elements do not have to be done in any particular order, but I do them in this order because it makes the most sense to me and because it's easy to remember. So the first one is sexual health. What is your STI status? And this really pertains to people who may be in new relationships, like they're meeting somebody new and they want to know, let's talk about our STI status, because people don't like to talk about it. And I've had so many of my patients say, oh my gosh, like that feels really awkward and strange. And I'm like, well, if you think about it as something that you want to be healthy and come to a relationship showing that you care about your body and you care about the other person's body, it's actually the best way of STI prevention is to talk about it. Because the truth is, most people don't always use condoms, and most people don't always have clear conversations around minimizing, or about our health in general. It's also a really important place to think about, like, what do we need to stay healthy in our body? So I think sexual health it's a topic unto itself, but just starting that thinking in that process is so important.
Well,
The
and it's
next one
also
is
important to, I'm sorry. I was just going to say, to me, it's so important to get that out on the table before there's any chance of like getting overly involved. You don't want to wait till you're in the makeout prelude section before you have that conversation. You don't want to wait till you're overly emotionally involved with someone before you have that conversation and risk rejection with that. I'm the cards on the table kind of person. I've evolved into that. And so I love that that's one of the first things that you broach.
Yeah. I mean,
Please go ahead.
all of this conversation should be done in the beginning. Like that's the ideal time. But if you're already in a long-term relationship, it still could be something that you talk about. You still could talk about your sexual health, right? Because
Yeah.
we're all, especially in long-term relationships, we change and we don't tend to want to address those things until they become a problem. So let's address them before they're a problem. So the next thing to talk about is your turn-ons. What is it that you like? How do you like to be touched? What is something that you desire? Like, what are your desires? It could be specifically in that encounter, that person, or in general. Like, some people are really into kink and some people are not, or some people want to dabble, or some people do not. So oftentimes we just make assumptions about what people want. And unfortunately, in this day and age, so much of what people think they want is informed through pornography because we don't have good sexual education and because we don't talk about sexuality. So where do people go? They go into the shadow and they go into pornography because that's the most easily acceptable way of figuring these things out. So now we have, a group of humans that think that that's what sex is. And that's not always what we want. So saying, like, this is really what I want. Like, I really like a lot of play before we get into anything insertive. Like, that's really important that we get to know each other's bodies. And we could do that through touch. We could do that through eyes. We could do that through talking, all of those things that turn us on, that make us really feel juicy and yummy and want to come to the table with somebody.
I can imagine that there are plenty of people out there that don't actually know what turns them on.
Oh, that is so true. And you know what? It gives us permission to think that we are allowed to have things that turn us on. When I've actually taught this, and I teach workshops and courses on this talk, I have had women actually just start crying when they get to this section because they're like, oh my God, you mean I could have something that turns me on? And I'll tell you something that is a little bit, of me, is that when I started this venture, I was in a relationship, a long-term relationship where I didn't know anymore what turned me on. And the only thing that I liked was the only place he could touch me is this triangle right here. Nothing else. I couldn't feel anything because I didn't know what turned me on. And it was during this journey of understanding the nuances and the amazing universe of sexuality that I realized, oh, I'm allowed to have turn-ons that are mine.
Yeah.
When I ask a lot of my patients and they come to see me and they're like, well, I have no sex drive. And I'm like, well, what do you enjoy? Like, what do you like? And there's so many of my patients want to have sex drive so they could accept insertive sex. so they could please their partners.
Oh,
But
yeah.
they don't really understand what it is they want yet. And that's what is so empowering about the Stars Talk, is it helps you kind of understand yourself and explore those things.
And just thinking about turn-ons and having conversations around that really gets the processes moving of, well, what does turn me on? Let me think about that. Let me investigate that a little bit. So I love that. And I'm hoping that everyone that watches this will start investigating more what turns them on.
Yes. And so then the next part is our avoids. And that's what we don't want. That's what they maybe are boundaries. And I think of boundaries as that liminal space that's between me and you that keeps us in relationship. And I think of like boundaries as the cell membrane. And cell
Mhm.
membranes tend to contract and expand to allow different things in and out. And learning how to have good cell membranes and contraction and expansion is how we stay healthy in relationships. So, kind of, again, our self exploration, our self awareness of what are those boundaries? Like, what do I need to feel good in a relationship?
Right.
It's also about our trauma and our triggers, because sexuality is just, we have so inherently, just from living in our culture, we have so much trauma. Even if we've never had sexual trauma, like specific consent violations, we all carry some sort of trauma that we could get triggered in.
Well, we're
So it makes us,
simultaneously repressed and also exposed, throughout
Mhm.
media. So I mean, like, but you're not supposed to be sexual, but you're supposed to show your boobs and your ass and, be sexual, but don't be sexual.
Right. And we're all supposed
Yeah.
to have a perfect body and like,
Right.
and but kind of understanding where your traumas might lie. And again, there's like, this conversation could be very, very superficial, or it could be super deep. And I'm kind of going into the deep parts of it right now. Understanding those places where we may feel a little wounded,
Mhm.
and being able to not only acknowledge that within ourselves and think, how does that show up in my body? When I feel dismissed, how do I look? How does it show up? And then how does it show up in the
Mhm.
sexual encounter?
Yeah.
Because it would be so good for me to tell my partner, like, wow, when I'm not feeling connected, I dissociate. And when I dissociate, this is what I look like. So that
Mhm.
when if they could be, it helps us teach our partners as well as ourselves how to be more attuned to one another.
Right.
And that attunement is where we get the best sexual experiences, no matter what we're doing.
Mhm.
It's creating attunement where the magic really can happen with us. And attunement really comes from understanding our turn-ons and our avoids. So and letting our partners know that, so that we could co-create something that really is wonderful and connected.
And again, it's the same with the turn-ons. I believe there's a lot of people that don't know or understand what their boundaries are. I mean, I, like myself, as an example, I had to learn the hard way what boundaries were. I had none to begin with as an adult, and then, had went through a divorce, and then all of a sudden I was on a rocky path of learning my boundaries and and how to show up for myself in health and wellness for my own self and my well-being. And I believe that's really what boundaries are. Anything that makes me feel like I need to retreat, then that's something I need to set a boundary with.
Right, right. Where's, because boundaries are that healthy space between us. So like when you're feeling constricted, or when things constrict, you want to not be able to be in that. So like, what do you need to feel openness again and connectedness? And yes, you know what, we're not taught boundaries. Like, we're
Mhm.
actually taught not to have boundaries,
Yeah.
especially if you've been raised as a female in our culture. We're supposed to be people pleasers. We're supposed to do what the others want. And sexually, like, that's the stories we're told, right?
Yeah,
Is that we're supposed to
absolutely.
make the other person happy, and they don't have anything to make us happy. Well, that's wrong. I'm resetting the story here. And I'm so glad that there are more conversations these days about what are boundaries, and and what that means. So,
Yeah.
so the A of the stars is avoids, which is boundaries and stay healthy. Now, turn-ons and avoids could actually sometimes you could have the same thing in both categories. Like sometimes people might want something with one person and not with another person. Or sometimes you might want to explore what's in your avoids. Like maybe being spanked brings a lot of trauma to you because of your history, but like with the right person, you may want to be like, I want to explore that a little bit with you, even though it's something that I've been avoiding. Like, how open are you to doing that with me since I feel like we're in a safe container? So like
Yeah.
sometimes things could be both. I just want to say that it's not
It's not
always
black
just
or
like
white.
you're one or the other. Yeah.
Yeah, I love that. It's very nuanced, and the conversation can change depending on how we feel within the container of the person that we're
Right.
with. Love that.
Right.
Okay, so we've got your sexual what
Health,
sexual health
health.
status. Yeah, you've got your turn-ons, you've got your avoids, and then R, which means
So R goes for our relationship intentions and our expectations. In
mm.
other words, this is what sex means to me.
Yeah.
And that is a really missing piece in the
Mhm.
way we approach sexuality. We to sit down and think like, what does it mean for me to have sex with somebody? What does it mean to be intimate with them? What is it that I need? What is it? What do I tend to do? Like, what are my intentions? Do I only have sex with somebody I'm in a long term committed relationship? Does sex mean something that is just pleasurable and I enjoy hookups? Does sex mean like BDSM and no penetration? Does sex mean something that is only for in my like I only self pleasure? So what does sex mean for you, and what are your intentions with it? And then expectations. People are like, "Well, I don't have expectations." I just want to call bullshit on that. I'm sorry. We all have
Every
expectations
one
of
of
how
us.
we want other people to treat us,
Yes.
and sometimes letting people know this ahead of time could be such a lifesaver because we live in this culture where we think that we're going to just figure it out by listening to people's body language and what they say, and we never talk about it, and we kind of try to, and half the time it just leads us to be hurt and to
Yeah.
feel, so actually understanding one's own intentions and expectations and then expressing it to a person that you're going to possibly create some intimate space with allows us to set up a really nice foundation and even scaffolding that then we could fit in the pieces together.
Yeah.
Um, in
It's
this
a,
in this
it's important.
conversation, yeah, in this conversation also, like you could say, this is who I am. Like I am a monogamous, non-monogamous, bisexual, non like you could say this is me. So
Right.
that's the relationship intentions and expectations.
I had a client recently who he's dating, he's in the field, and then he's experimenting personally with people, just like, hey, getting to know them as people. And then, but every once in a while, someone will come up and say, well, you're my person. And he's like, I'm still getting to know you. And it came out that they're saying that because they're hitting a roundabout way of saying, in order for me to have sex with you, I need to know I'm the only person you're having sex with. But it's not in their consciousness, it's not in their awareness. They're just kind of coming around the back end with it. But if they were to be more direct, if they were to be able to say, oh, that's it. I can only have sex if I know that you're my person and we're dating and we're monogamous. So being super clear on that, I think, is extremely helpful because, otherwise the other person's like, well, I don't really know what's going on here.
And then we play games with each other.
Mm.
We'll be like, oh yeah, I'll be your person because you want to have sex. And then that can really lead to a lot of heartbreak
Oh, yeah.
because we manipulate each other. Like sometimes that sexual attraction and drive can be so strong that you're willing to say, oh, okay, I'll sleep with him. So then once I sleep with him, I'll convince him that he's my person, right? Then
Hmm.
and then there's this manipulation in these games. And what I'm proposing with the stars talk is to actually be authentic and to be vulnerable. I mean, this isn't easy. I'll preface all of it. Like, this isn't easy. It's different. We're not taught how to do this. We're not taught how to be vulnerable. We're
Right.
not taught how to ask for what we want. We're
Mhm.
not taught to listen to somebody else for what they want and where we can meet each other.
Yeah.
So,
Yeah. Super important. So, okay. So we've done the STAR and now the S part. Where
okay,
are we
so the
at?
last S part may be one of the most important parts, and it's the safety needs.
Mm,
So, oftentimes when we think of safer sex, we think of like condom, we think of decreasing STIs and undesired pregnancies.
right.
And safety is so much bigger than that.
Mm,
It's really having a conversation about, what do I need to feel safe with you? And what does that look like? And yes, it could be about STIs and it could be about pregnancy, but it's also about like alcohol and drugs, right? Let's
mhm.
bring that into our conversation. Let's say, like, for me personally, when I'm with somebody new, I want to be sober and I want to know that they're sober, because consent is very difficult to achieve when you're not sober. And if you're just starting out with someone and you're not sober, you bring in other elements, it could
Mhm.
really create havoc. So, like, that's something that I think is helpful to address up front.
And
Um,
would
other
you
thing,
put like I'm sorry. Would you put like buzzed, someone who's buzzed, would you consider that not sober enough to be able to completely consent?
you know what, that's really up to me and that person and how I feel. Like, honestly,
Okay.
to me, it's like, oh, we can have a couple, like, if we're new, once I know somebody, then that's not that, I don't hold that, like, it's okay.
Right.
But, like, if I know that I may be sexy with somebody, like, I don't want to drink more than 2 drinks, and I hope they don't drink more than 2 drinks, because, like,
Right.
then it becomes sloppy, and
Yeah.
I don't want my first encounters to be with somebody that's sloppy. um,
I
right.
hear you.
And I think
Yeah.
this is an important conversation also for young adults, and people who need, sometimes I've had young adults say, I need to be a little drunk in order to have sex. And I'm like,
Mm,
okay, what does that tell me about your safety needs? Like, what are you not being met at so that you feel comfortable enough to be in your body? And if you need to be drinking in order to have sex, are you really ready to be having sex with that person?
that's a fantastic question because I mean, to imply that they would need to have a couple drinks to loosen up enough to have sex, then there's some kind of restriction there, whether it be emotional or physical or mental.
Right,
Yeah.
right. And other places that this is important is also like, what does your spiritual and religious history, how does that play into your feeling of safety?
Mm,
If you've been brought up in a really, you know, in a religion that doesn't value open, fluid sexuality, that only values it within a marriage, and you are no longer that, then it may be harder for you to feel safe. And what does that mean? What do you need in those situations to feel okay? And that might mean, look, I need to make sure that you're going to be monogamous with me, and that's part of the safety. Or I need to know that I have a true connection with you, and that's a safety.
right.
Um, for me personally, like, I really view sexuality as very sacred. It's a sacred act for me, personally, and for me to feel safe with someone, they need to be aware that they're entering that sacred space with me.
Yeah.
And if they are not, if they can't, or that's not the way they're built, and they just want, then it allows me to sit there. Okay, is this something I want to do or not? And I have the sovereignty to make that choice. I could be discerning enough to decide if this is right for me or not. So safety needs, are big. It could also have to do with race and culture. Like, is it going to be safe for me to be with you? Could
Mm,
we discuss that? Could we have an open, honest conversation that this could be not safe for me in this
right.
situation, or it might be. It may not be safe for me because I am a Muslim woman to be with a white man. It's just like, I'm using that as an
Right.
example. It's also really important in the safety conversation to talk about things like, what if things go wrong? Like, what if we use condoms and the condom breaks and a pregnancy ensues. What are the issues there? So that may come up with younger people. I like to bring that up.
Yeah, that's so amazing. Like I think more people need to address the what if what if scenarios, because you just never know when something could go wrong. I mean, I had an oops an oops child who I adore and I'm so grateful for. And at the same time, like we didn't have that prequel conversation of how to deal with that. After that I learned, and I've had that conversation since, but so it's
Yeah.
very valid what you're saying here. I love it. Yeah.
I mean, I know a young man who, had a hookup after a party when he was 21 that ended up with a pregnancy, and all of a
Mm.
sudden he's a dad, and it changed the whole trajectory of his life. And
Yeah.
so these conversations are really important to have beforehand. I and so this conversation, again, it could be very easy and superficial. You could just hit the highlights, like, hey, I want to use condoms. If I get pregnant, I would probably feel like I would want to have the baby. um, I'm okay with going to a party and drinking and getting drunk, but you have to know that. Like,
Right.
it doesn't have to be this really big, intricate discussion, but it could be. So
It could be.
that's what I love about the Stars Talk, is that it could be, I mean, I could give you my Stars Talk in less than 5 minutes, or I could take days, depending on where we're at. Um, and honestly, like, I have my Google documents, like I wrote it all down, and I constantly update it. And then sometimes with my partner, we'll sit down and we're like, hey, let's do our Stars Talk again. We've been
I
together
love
6
that.
years, but let's check in and see how things have changed and where
Well,
we're
because
at.
don't you think sex is evolutionary, like much like any other aspect of identity, who we are? It's I know for me personally, it has changed so much in the last 20 years. Like, a little bit
Mm-hmm.
repressed, a little bit too open, and then, now how I approach sex is way different than even just, several years ago.
And it changes through our lifetime. It changes through our lifetime. It changes from people when they're, and we think like, oh, once you're postmenopausal, you're not going to be sexual anymore. I
Mm.
have patients that are in their 80s that are still incredibly sexually attuned and dynamic and alive. So I'm not going to say that, like, oh, it dies at a certain age. It really just changes and shifts, and navigating that. But it's very, very hard to navigate when you're not in, when it's repressed. When
Yeah.
this is sex positivity. You asked me in the beginning, what is sex
Right.
positivity? Sex positivity is addressing these 5 elements. Sex positivity is recognizing that sexuality serves a purpose beyond reproduction. It helps us get some of the things that we really want out of life. And I kind of think that the things that we want, I believe that there's three main fundamental things that as humans we desire. We desire safety, we desire connection with others, and we desire love.
Mm-hmm.
And sexuality is one of those places where it could bring you all three things.
Yeah.
It could bring you safety within your body, it could bring you love, and it could bring you connection. So why aren't we talking about it? Why aren't we owning it? Why are we giving all this important thing in our body, and giving the power to other people? Why are we giving the power to culture to say we have to be silent about it? Why are we giving all the power to only the partners that we have? Why aren't we, as humans, recognizing that by taking that power and liberating this life force energy, we're doing self-care. We're like
Mm.
becoming, all of us, the whole person that we could actually be, and hopefully, be better able to connect and better able to love, even if you're not having sex with somebody. Like, it's not about having sex with them.
Right, right. It's about being sovereign over what you choose to have as in terms of your sexuality, what you choose to experience. And it's this whole thing, the whole conversation around the stars talk and the rest of this conversation is really empowering, to help people to start thinking about what does it feel like to have and embrace my sexuality on my terms. Yeah.
The reason I do this work is not just for you and me and all of us. I really do this work for our children because we're living in such challenging times, and so are our children. And if we have children, anywhere from little babies to our 30, 40-year-old children, and I realize that we haven't done a good enough job to help create a consent culture, to help create a model where we own all of our power in all the different ways. So by creating this stars talk and starting to integrate these ideas and we pass it along to our children, we are creating a framework for their liberation. We're creating a framework for them to really understand the important elements of sexuality and of relationships. We're not taught relationship education. We're taught sex education, and it's very physiological.
Yes.
Sex is relationships, right?
Yes.
Relationships to yourself, relationships to others. And these are the 5 missing pieces. We talk about STIs in sex ed, but only as a fear, not as a way of how do we help each other stay healthy?
Well, and we've got that fear breathing down our necks the whole time we have sex with people about unwanted pregnancy and STIs. But then there's no one on the other end saying, okay, that happened. Now this is what you do. This is how you move forward from that. And that's one thing that I really loved about, what you present to the world. And also in your website, you've got lots of information on, okay, you've got human papillomavirus. This is what you do. This is how you talk about it. This is how you embrace it, because it's not going to change. So what do you do with that? Do you bury yourself in the shame of it forever and ever? Amen. Or do you carry on and find your way through it? So go ahead.
It's hard, because of culture. I've had people tell me that they rather have a cancer diagnosis than a herpes diagnosis.
Wow. When isn't there approximately 50% of the planet has herpes, they just don't always know it.
Exactly. Yeah. And it's just okay. I had this patient come in and she wasn't feeling well, and I was seeing her for her not feeling well, and then at the end of the visit she was like, I have this rash down in my genital area. And all of a sudden I'm like, oh, okay, are you having a herpes outbreak? Because that fluish feeling, and she had been put on antibiotics and she wasn't feeling better. And I looked at her and I was like, whoa, this could be herpes simplex, which is the genital herpes that we're frightened of. Or it also could be herpes zoster, which is shingles caused by the chickenpox virus. They're part of the same herpes family, and they could look very similar. And I told her this, and she, all of a sudden started crying. She was like, I have been married for 30 years. How could this be herpes simplex? And I'm like, sometimes different elements cause it to show up. You might have had it for years. Your spouse might have had it, not known it. There's all different reasons, but I don't know that that's what it is. I'm not going to tell you that's what it is. So I'm going to test you. And it's probably important that you have a conversation with your spouse about that. It could be one of these 2 things. And if I'm going to put money on it, I'm going to guess that it's shingles. But so she went home and I saw her the next week. She came back and it came back to be shingles, herpes zoster. And so I told her, and she's like, oh my God, that this was the very first time in my whole marriage that we talked about sex.
Wow.
We never had a conversation because I've always been so ashamed about having sex. And I was told that if I can't talk about sex, then I shouldn't be having it. So my whole life, I felt this like shame about having sex and not talking about it. And this really opened me up to having this conversation with my spouse. And we both were like, no, we don't think it could be, herpes simplex because we both been monogamous and we've been together. But let's talk about all the fears around what it could mean and all of that stuff we've just never had a conversation about.
That's fantastic. I mean, sucks that she had shingles. Absolutely. I
Right,
hear
right,
that's
right.
miserable. But fantastic that it prompted them to have conversations that never would have taken place otherwise. Um, for me personally, that's one thing that I can really admire. I really admire and respect, especially in people that are non-monogamous. The conversation quality that they're having with their partners is far greater than the conversation quality that I'm seeing with monogamous people. Um, and and that is just astounding. And to me, it holds a whole new level of standard for monogamous folks, including myself, to raise that bar of communication. They're having these conversations regularly or seemingly so, um, within the functionality of their relationship. They kind of have to, and I think that monogamous people get kind of complacent, you know. So being proactive and having these conversations is incredibly important, especially as we mature in our sexuality.
All of it. And the stars talk was not written for non-monogamous people. It was not written for polyamorous people. It was not written for kinky people. Yes, they're probably the people that like it the best. And they're the people who, and they're the people who like, oh, great, this really helps us. But this conversation is really written for the mainstream. It's taking all of those things that I learned from these sexual subcultures and bringing that awareness to all of us.
Yeah.
I don't care if you're, what gender, what or sexual orientation, what relationship configuration you have. These are things that we all really need to learn and
Agreed.
develop the skills to communicate this with one another. I really believe that we could change our whole world through this conversation.
I
Maybe
agree.
that's
I
saying
mean,
a lot, but I do.
well, it helps to eradicate that constriction and potential shame that we have around sexuality when we are intentionally addressing it through this type of conversation. So, and I believe that people that are in monogamous relationships, because they haven't had it tested, that they're the ones that experience more restriction and more shame around having conversations like this, for whatever reason. I mean, maybe just the multiple partners have given more experience, and with experience comes comforts to a degree. But yes,
That's
yeah,
it. That's it. You said it. And when people don't have experience in having these conversations, it feels challenging, right?
yeah.
Like, how do you bring it up? I've had so many people say, oh, it's so awkward to tell somebody what I like. I'm like, really? Isn't it a little awkward when you first get naked with a new partner? I mean, it's awkward, right? I mean, sex is awkward. Sex can be a little strange. So,
It can be,
yes,
yeah.
we don't have models. And this framework is there to give a model. It's there to help us. And with practice, it becomes easier. With practice, it could become just, I mean, I'm hoping that it will become better known and people can start practicing it, even if they practice it for themselves in front of a mirror or they practice it with friends at first. And so it's like, oh, okay, I could do this. It doesn't even have to be done like face to face. As I said, like I have a document that I keep a Google Doc, and I will update it or I'll change it. And sometimes I'll send it to a potential partner if they've never heard of this before. I'll be I'll be like, hey, this is my stars. Maybe you want to send me yours. And that causes them to sit down and think about like, what is it that turns, like it makes them think about
Yeah.
it when you have to write it down. The other times I've done it, like I've done it on dates, like first dates. I'm like, hey, I have this game I want to play. Want to play with me? and I make it into a game. So
Mhm.
it doesn't have to be something awkward where you're like, oh, wait, let's have this safer sex talk now. And, it
Right.
really
Yeah.
should be done. Yeah,
Along with the other open-ended get to know you questions, right?
exactly. Exactly.
Yeah.
Exactly.
Yeah. So tell me about your, previous relationship. Well, tell me about your turn-ons. Yeah. I think that's fantastic. And, as
Uh-huh.
far as like, really for the children and teaching them so that they can have a more empowered sex life when they get older and feel safe, right? I think that um, really is necessary in our society because I was a Girl Scout leader for a long time and I wanted to have this is your body changing talk, right?
Hmm.
Like a few girls already started their periods by the time I wanted to have this conversation. And I just wanted to address it and normalize it. We're going to have periods. That's what's going to happen. You're going to have some body growth. I invited the nurse from the school, but it was a Lutheran school at the time. And there was so much resistance from these parents for these fifth grade girls to talk about their body changes. And one woman told me she was flabbergasted. She was just in shock that I wanted to do this. She's like, my daughter doesn't even know I bleed every month. I'm like, how can your daughter get to fifth grade and not know that you have a moon cycle? Like, how did that? Fortunately, the fear of me having the conversation with her daughter prompted her to have the conversation with her daughter. So yeah, I think that this being proactive with kids is incredibly important. Before they even start having sex, they can start thinking about what's this going to look like? What's it going to feel like? What do I need in it? Because no one
Even
ever.
normalizing, right? Normalizing that you're going to have things that make you turned on, right?
Mhm.
That's valid and it's okay. Whatever you have that turns you on, like touching yourself is okay. And also, like, you might have places that you don't feel good about, and listen to that. Like, start teaching children that are to listen to their intuition and to
Mm,
speak what they need, and recognize that, like, you're gonna have people cross your boundaries. You're gonna end up having boundary issues, and you can learn from those.
yeah,
They don't have to be something that causes ongoing trauma. You could say, oh, yeah, now that is a boundary. Okay, now I know it. You could talk about all of this without ever using the word sex.
right. I love that. And great clarification. And the fact that they can learn how to communicate, because again, talking about things that they're not being taught, relationships, communication, boundaries, none of these things. And this brings us all to the table. Yeah, I love that.
Yeah. So I hope that, stars, or the concept of stars, is something that could be uh, something that could change our culture for the better, so that the whole idea of it is really about getting to know ourselves better, our needs better, empowering us, and co-creating the true kind of relationships and love and enjoyment and pleasure to be human on this earth at this time. I feel like we're all so blessed to be here, even if it's hard, and we struggle, and
Mhm.
we just went through this like global pandemic, which all of us can't help but having some trauma around.
Right.
Isn't it great that there can be something that could make life
Yeah. And you have had quite a journey yourself going from medical doctor and then exploring all of this stuff and integrative physician and then you're sex positive now, like that's quite a
better?
story in and of itself, and I personally am looking forward to learning more about that. But for the purpose of our talk, would you please, Dr. Evelin, would you please reiterate what the acronym STARS stands for?
Okay, so it stands for the 5 elements that will help us, have better relationships and sex. And there are sexual health, our turn ons, our avoids, our relationship intentions and expectations, and our safety needs.
Love it. Thank you. And remember, sex isn't for the other person. Your sexuality is for you. Thank you, Dr. Evelin.
Mhm.
I appreciate you for
Thank
being
you.
here.
Thank you for the invite. It was my pleasure.